Welcome back. The Biden administration is planning a whole-of-government approach to vaccine distribution. The White House says it will enlist the help of not just the public health agencies, but the Departments of Agriculture, Education, Labor, and HUD, too. Jonathan Alboum is Federal Chief Technology Officer at ServiceNow. He's former Chief Information Officer at the Agriculture Department. Jonathan, first of all, happy birthday. Is all of the things one would do on one's birthday. Appearing on TV to talk about vaccines is probably not what I would expect to be at the top of the list. So I'm grateful that you joined me today. What do you see as a whole-of-government approach working, given what we've talked about over the many years about all the silos that are up between agencies?
Well, COVID-19 vaccine management is probably the most significant workflow challenge of our lifetime. You're talking about processes that span all levels of government, federal, state, and local, all the agencies you described, plus the private sector, the companies making the vaccines, the companies that are transporting the vaccines, the doctor's office, clinics, pharmacies. So when you take that together, the scale is really unprecedented, I think, and the speed and flexibility that we require in order to be successful is really complicated. And we want to assure effective and an equitable distribution of vaccines. So I think what the Biden administration is realizing is that you can't go it alone, and you can't just create a vaccine and then delegate operational authority for distributing it to states without helping them. And that whole of government approach, I think, is really what it's going to take. We're all in this together. And to the extent that we're able to think about how all of the data and how all of the work flows through this big process, we're going to get better outcomes, and we're going to get more people vaccinated faster.
I ask this as a genuine and not a cynical question. What do agencies like Agriculture and HUD and others have to offer to the whole of government approach to help get the vaccines into people's arms quicker?
Sure. So, when the president, announced this plan, he began by stating that FEMA would run 100 federally operated vaccine centers. And those vaccine centers are going to be all over the country. And if you think about an agency like the Department of Agriculture, there are 2,000 plus county offices all over the country. And while those county offices have employees that may not be clinicians, they do have a very strong connection into those rural communities. So there's a way to publicize the availability of vaccines. There's a way to connect with people who may be able to support those centers from, again, an operational perspective, because the plan also includes recruiting volunteers and others. So when you have a strong touch in the community, I think that's a way to enhance the processes that the administration is talking about.
A lot has been made, Jonathan, about the digital transformation that agencies are undergoing. We heard about the one at GSA earlier in this program and others across the government. What opportunities are there to leverage the transformation elements that agencies have already undertaken? And what's the potential to be able to assess where agencies still need to go as a result of what maybe doesn't work as well as it should in this vaccine rollout?
Yeah, I think that's a really, really great question. It's clear after, a few months of having the vaccine that our systems really need to be able to scale. And, we're being successful, and how we are successful is about being able to go fast. And, in order to go fast, I think we have to rely on, the platforms that we have in our organizations that have been successful, that are secure, and have elements of interoperability. Because when you think about the core use cases that we need to be thinking about, if you think about one of those vaccine centers that I mentioned, the people running that have to be thinking about how they distribute vaccines, tracking information that cuts across a lot of systems and a lot of agencies and levels of government, and then being able to administer vaccines, having people scheduled to be there, having the PPE available for them to safely administer vaccines, to be able to monitor outcomes. Those are all activities where digital transformation can have, a profound effect. We want to be using technologies and approaches that have a human-centered design approach, so they can be easy to interact with, and connect data and systems that need to work together to make this successful. And that's on the management side. When you think about the side of the the recipient of the vaccine, they're worried about getting the right information. They have to be able to quickly interact with, the vaccine distributors and get updates on their availability to get the vaccine, the availability of the vaccine itself, and their eligibility, and also get notifications and updates. And this is a two-shot course in all cases at this point. And I read a published report recently that in Florida, in the middle of January, there were 40,000 people who received dose 1 and had not received dose 2 on time. And was that because they forgot, or they weren't notified, or didn't have the right information? We have to make sure those information gaps close quickly. So those are all digital transformation opportunities that I think are very important as we push forward.
A little bit more than a minute left, Jonathan. If you sat down with a federal CIO today and that person said, Jonathan, what can I leverage all of this as an opportunity to do that isn't necessarily pertinent to the virus or distribution of a vaccine or any of that, but is going to benefit my organization 5 years from now, what would you tell that person to focus on?
I think it's about making sure data and systems are connected and work together. There was another report this week that there are 20 million doses that are unaccounted for. They were distributed from federal distribution centers to states, and we don't know where they are at the moment. So that's just an example of how important it is to understand how the data moves through our systems inside our agencies. And to the extent that we can use these activities to double down on the digital transformation that we're in, the understanding of our data, the understanding of our work, and how those things fit together, then the work we're doing as IT professionals is to a degree in alignment with the work that our scientists did to create vaccines in record time. We now need technology and management solutions that go along with this great achievement, so we can get as many people vaccinated as possible as quickly as we can.
Jonathan Alboum, thanks very much for joining me. Happy birthday.
Thanks again, Francis. Great to be here.